Hi, welcome to the Ascension Medical Minute. Today we're talking to Dr. Patrick Jost. He's an orthopedic surgeon with the Orthopedic Hospital of Wisconsin. And Dr. Jost, you wanted to share a story about a high school football player that you treated.
I do. So a nice young man, unfortunately tore his ACL twice, had had surgery at another institution, and things just didn't go well. And they came to me for a second opinion. We talked about options and ways to improve, and they put their trust in me, which was great. So he and his family came in for a second surgery. They went through all the rehab, really dedicated himself and worked hard. And in the end, he was ready to go back. It was actually, he was in college by then, and he was able to start and play 4 years and had a lot of success.
Wow, and you've got a picture of him in your office.
I do. His family was nice enough to clip out a newspaper article from their local newspaper, just talking about the adversity he had been through and his success. So it's a great thing on the wall I get to see every day.
That's so great. That is compassionate, personalized care. Dr. Jost, you were telling me that sports medicine is really special for you because you get to treat a patient and really impact their life. Talk more about that.
Yeah, I really enjoy it. It's such a gratifying job. I see people who are hurt or have torn something, or maybe a joint is worn out, and we really can take them from a terrible place to better in most cases. We see people who can't play sports, who then we're able to get them back on the field. We see people who can't play with their grandkids, can't sleep, can't work, and in many cases we can get them back to functional and happy and comfortable.
And it impacts you were saying.
It really does. I'm just built in such a way that I have to have those smiles and those happy patients. I go to clinic and I really enjoy it. It's such a privilege to do this job.
That's great. And they really have seen, something that they never would be able to experience in terms of playing with your grandkid or sleeping well. Those little things, I'm sure when they come to see you after the surgery and after all their treatments, that they're like on cloud nine.
Most of them are. I mean, people don't realize how important those little things are until they don't have them.
Right.
So when a patient comes in and they can't, I mean, a lot of what I do is conversation. People come in and there's some tears in the office, and there's some despair when they can't do simple things, or when they can't play whatever sport it is that they've done their whole life and they just can't do it anymore. But what a great opportunity. I can tell them I have a solution. And in most cases we'll get them right back to where they were, or sometimes even better, and that really, it's a joy and a privilege.